If your legs won't stop moving at night, and you've already tried magnesium, stretching, or even cutting back on caffeine, listen closely. Because the real cause of your restless legs syndrome might be sitting in your medicine cabinet. According to research from the Mayo Clinic and Harvard Health, 5 common medications prescribed to older adults, including ones for sleep, anxiety, and allergies, can actually make restless legs syndrome significantly worse. These aren't rare drugs. They're medications you or someone you love might already be taking. And if no one warns you, you might keep taking them for years without realizing they're quietly destroying your sleep and quality of life. But today, I'll show you exactly which meds to watch out for and what you can do instead without giving up your health or peace of mind. You know, one of the hardest parts about treating restless leg syndrome, or RLS, is that the solution isn't always straightforward. A lot of folks come to me and say, "Doc, I've tried everything. I'm eating better, I'm taking my magnesium, I even cut out my evening coffee. So why are my legs still going crazy at night?" And when I ask what medications they're on, that's when the light bulb goes off. See, what most people don't realize is that RLS isn't just about your legs. It's actually a brain issue. It has to do with how your brain uses a chemical called dopamine. Dopamine helps regulate movement and relaxation, especially at night. But here's the kicker: several medications, including some very common ones, block dopamine in the brain. They don't mean to. It's just a side effect. When that happens, your brain has trouble keeping your legs still. It's like hitting the brakes on dopamine, and your body responds by hitting the gas. Now, I'm not saying these medications are bad or that you should throw them out. Many of them help people manage anxiety, depression, insomnia, or allergies. But for someone with RLS, especially seniors, these drugs can quietly worsen the symptoms without warning. And because older adults are more likely to be on multiple prescriptions, the risk is even higher. According to the CDC, nearly 90% of adults over 65 take at least one prescription medication regularly, and more than half take 5 or more. That's a lot of opportunity for drug interactions, and a lot of chances for your legs to suffer the consequences. So now that we understand the why, let's talk about the biggest culprits, the 5 types of medications that can make restless leg syndrome significantly worse. And I'll show you what safer alternatives exist, ones that your doctor can help you switch to, if needed. Let me tell you about one of the most surprising RLS triggers I've seen in my practice: allergy medications. Yep, the stuff people take for hay fever, runny noses, and itchy eyes. They seem harmless, right? Especially the over-the-counter kind. But some of the most common ones, like Benadryl or diphenhydramine, can quietly wreak havoc on your legs at night. Here's why. Most antihistamines are sedating, which means they're designed to make you feel drowsy. Sounds perfect for bedtime, right? Not exactly. Because while your eyelids might feel heavy, your nervous system gets restless. These medications block histamine in the brain, and that messes with how your brain balances alertness and movement. In people prone to RLS, this can lead to a night full of twitching, jerking, and that awful crawling sensation deep in your legs. And the kicker? These drugs are often found in sleep aids too. So if you're using something to help you drift off, but your legs start acting up, the very pill meant to help you sleep might be sabotaging your night. I once had a patient named Martha. She was 72, healthy, sharp as a tack, but she couldn't get through a full night of sleep. Every time she laid down, her legs would start that familiar buzzing and jerking. Turns out, she'd been taking diphenhydramine every night for months, just a little pink pill to help her sleep. We took her off it, slowly, and within 2 weeks, the symptoms nearly vanished. So what can you do instead? If you need allergy relief, talk to your doctor about non-sedating antihistamines like loratadine, Claritin, or cetirizine, Zyrtec. These are much less likely to mess with your brain chemistry and tend to be gentler on RLS. As for sleep, we'll talk about that later in this video. There are better, safer ways to drift off without triggering restless legs. Now, I want to talk about a category of medications that's a bit trickier, but incredibly important: antidepressants. If you're over 60, there's a good chance you or someone you love has been prescribed one. And that's nothing to be ashamed of. Depression, anxiety, and grief, they're all real parts of aging that deserve care and compassion. These medications can be life-changing. But here's the catch. Many antidepressants make restless legs syndrome worse. Especially a group called SSRIs, selective serotonin reuptake inhibitors, like sertraline, Zoloft, fluoxetine, Prozac, or paroxetine, Paxil. These are some of the most commonly prescribed medications in the U.S. Now, here's what's happening behind the scenes. These antidepressants work by increasing serotonin in the brain, a chemical that helps regulate mood. But serotonin also plays a role in how the nervous system sends signals to your muscles. In some people, more serotonin can throw that system off balance. Instead of relaxing your body, it can trigger those awful nighttime sensations, the jerking, the crawling, the itch you can't scratch. And I've seen this firsthand. One of my patients, Mr. Collins, came in feeling like he was falling apart. He was grieving the loss of his wife, barely sleeping, and his legs felt like they were trying to run a marathon every night. His doctor had started him on Prozac a few months earlier. It helped with his mood, sure, but the RLS came out of nowhere. Once we recognized the connection and switched him to a different medication that didn't aggravate his symptoms, everything changed. He said it was the first time he slept through the night since his wife passed. I want to be clear here, do not stop taking antidepressants without speaking to your doctor. But if you're dealing with restless legs and you're on one of these medications, it's worth having a conversation. There are alternative antidepressants, like bupropion, Wellbutrin, that tend to be easier on the legs. Sometimes it's not about stopping the medication altogether, just switching to a different one that plays nicer with your nervous system. The key is awareness. Once you know what might be stirring up your symptoms, you can take back control. Let me ask you something simple. Have you ever taken something for nausea? Maybe during a stomach bug, after surgery, or even just to ease motion sickness. Well, here's something most folks don't realize. Many common anti-nausea medications can actually make restless leg syndrome worse. Especially ones that affect dopamine, a brain chemical that plays a big role in movement and muscle control. Medications like metoclopramide, you might know it as Reglan, or prochlorperazine, compazine, work by blocking dopamine in certain areas of the brain. That helps with nausea, but in people with RLS, that same dopamine disruption can spell trouble. And I mean real trouble. These meds can trigger or worsen the twitchy, crawling sensations in your legs. Some people even develop full-body restlessness, where they can't stay still at all, especially at night. Let me share a story. Mrs. Turner, a sweet 74-year-old lady I once saw, came in feeling desperate. She'd been taking Reglan for chronic nausea after a gallbladder surgery. It helped her stomach, but within a week, she couldn't sit through dinner or sleep a single night in peace. Her legs wouldn't stop moving. She thought she was going crazy. Her husband said she gets up and paces around the house at 2 in the morning. It's like her body forgot how to rest. We did a full review of her medications, and sure enough, the culprit was her anti-nausea drug. Once we tapered her off and found a safer alternative, her symptoms didn't just improve. They nearly disappeared. Now, here's the important part. Not all anti-nausea medications are harmful for people with RLS. But if you're struggling with restless legs and taking any drugs like Reglan, compazine, or similar, talk to your doctor. There might be better options that don't disrupt your dopamine system. And sometimes, lifestyle changes, like eating smaller meals, staying hydrated, or managing acid reflux, can reduce nausea enough that you don't need meds every day. The bottom line? If your legs won't leave you alone at night, it's worth double-checking that little pill you took to calm your stomach isn't secretly stirring up your symptoms. Let me take a wild guess. You probably have a bottle of Benadryl, Claritin, or maybe some nighttime cold medicine sitting in your cabinet right now. Right? It makes sense. When allergy season hits or you come down with a cold, you just want to breathe better, sleep better, feel human again. But here's the thing no one tells you, some of those over-the-counter pills can quietly make your restless legs worse. Much worse. I'm talking about antihistamines, especially the first-generation kind like diphenhydramine. That's the active ingredient in Benadryl and most nighttime cold meds. These drugs are sedating. They make you drowsy. But they can also mess with how your brain handles nerve signals, and that includes the signals that control movement and muscle rest. So while you're trying to fall asleep with a runny nose, your legs are throwing a party of their own. They're jittery, restless, impossible to calm. And you lie there awake, hour after hour, wondering what on earth is wrong with your body. Now here's something you should know. A major review published in the journal Sleep Medicine Reviews found that these older antihistamines are one of the most commonly overlooked triggers for nighttime restlessness. They interfere with dopamine in the brain, and that can worsen or even cause symptoms of RLS. I had one patient, Mr. Jeffries, 69 years old, who came to me saying, "Doc, I only started having these restless legs a few months ago. I didn't change anything." But after a bit of gentle digging, we found the answer. He had started taking nighttime cold medicine every evening because of seasonal allergies. Once he stopped, his symptoms dropped by 80% within 2 weeks. So here's the takeaway. If you're taking allergy or cold medications, especially anything labeled nighttime or PM, and you notice your legs getting more restless, don't just brush it off. It could be more than coincidence. It might be time to switch to a non-sedating option, like loratadine or cetirizine, but always ask your doctor first. Sometimes, fixing restless leg syndrome isn't about adding a new treatment. It's about subtracting the thing that's secretly making it worse. Now, this next one might surprise you, and it might even feel a little personal. Because when we talk about depression or anxiety, it's not just something in the head. It affects your whole body. And sometimes, the medicine we take to help our mind ends up disturbing our rest in other ways. Yes, I'm talking about antidepressants. Especially a group called SSRIs and SNRIs, medications like fluoxetine, Prozac, sertraline, Zoloft, or venlafaxine, Effexor. They're some of the most widely prescribed drugs for older adults dealing with low mood, grief, or chronic stress. And they've helped millions of people. But here's the catch, they can also interfere with the brain's dopamine system. And as we've talked about, dopamine plays a major role in calming and coordinating your muscles at night. When dopamine gets disrupted, the legs don't stay still. They twitch. They cramp. They feel like they need to move again and again, especially when you're trying to sleep. One large study published in Neurology in 2005 found that people on certain antidepressants were twice as likely to report symptoms of restless leg syndrome compared to those not taking them. And other studies since then have confirmed the link, especially in women over 60. Now, I want to be very clear, this does not mean you should stop taking your antidepressant on your own. These medications are often essential for mental health, and stopping suddenly can be dangerous. But if you've noticed worsening RLS symptoms after starting one, it's worth having a gentle, honest conversation with your doctor. There may be alternatives. Some antidepressants are less likely to worsen RLS, such as bupropion or mirtazapine, depending on your needs. Or sometimes, a small adjustment in the dose can make a big difference in how your legs behave at night. You see, managing restless legs isn't always about adding new pills or supplements. Sometimes, it's about stepping back and looking at the full picture. The medications, the timing, your sleep, your stress. It all plays a part. And you deserve answers and relief without sacrificing your peace of mind or your mental health. So if you've made it this far, first of all, thank you. I know this wasn't an easy topic. No one likes to hear that the medications they rely on might be causing other problems, especially something as frustrating and exhausting as restless leg syndrome. But the truth is, this condition doesn't come out of nowhere. In many cases, it's your body trying to send you a signal that something's out of balance. Maybe it's a missing nutrient. Maybe it's a pill that's messing with your dopamine. Or maybe it's a combination of small things building up over time until your legs just can't stay still at night. The good news is, you don't have to just live with it. You don't have to suffer in silence or lose hours of sleep each night wondering what's wrong. Because now, you know better. And once you know better, you can do better. You can ask smarter questions. You can check your meds with fresh eyes. You can speak with your doctor not just about your mood or your blood pressure, but about how your legs feel when the lights go out. You deserve rest. You deserve peace. And you absolutely deserve to feel like your body is working with you, not against you. So if this video helped shine a light on something you hadn't considered before, if it gave you even one useful clue for a better night's sleep, here's what I'd love for you to do next. Backhand index pointing right if you found this helpful, give it a thumbs up. Backhand index pointing right if not, type 0 in the comments, but if it helps, let us know by typing 1. Backhand index pointing right, and don't forget to subscribe for more life-saving health tips, tailored just for you. Because getting older doesn't mean giving up comfort or control. It means getting wiser and learning how to take care of yourself with compassion. Thanks for spending time with me today. Wishing you steady legs and sweet dreams tonight.